Good evening, good morning, good afternoon, everybody, depending on where you are joining from. As you can see on the right, that's Dr. Silverman waving. My name's Simon Ramshaw, and based in the UK, we look after Erchonia Corporation's interest in Europe, the Middle East, and Africa. And that is my pet cow, Angus, on the picture behind, as you can all see. So it's not actually horns coming out of my head. Thanks very much for giving up your time, everybody. I know I always do this intro, and there's quite a lot of you that are on most of the calls we do, so you know who I am and you know who Dr. Rob is. But for those who haven't come on before, I will make the intro. This webinar is specific to basic intro into laser therapy. And it's something I think that Dr. Rob Silverman and Dr. Rob Sullivan and I have discussed quite a lot, because when we launched the lasers in Europe for Erchonia, there was a lot of gray areas around what low-level laser is. It's quite a sizable umbrella with lots of delivery mechanisms underneath it. And we came across situations where quite a few doctors said, oh yeah, we have a laser, but it was infrared or it was LED. So we figured the best way to do things is to go back to basics. And this is basics across the board, to give you the knowledge that you need to be able to make the right decision if you're going to introduce laser into your practice. So without further ado, I will introduce you to that handsome chap on the right, Dr. Rob Silverman. Rob, we've been dealing with now for a couple of years. We were lucky enough to meet him at the Scottish Chiropractic event. I think it was in June 2019, where he was lecturing. He came back to London, December 2019, to also do a lecture there, and has also been to Dubai with us as well. And his lectures are always a sellout. He's a very knowledgeable chap, very sociable, comes across in a very friendly manner, which we all love across here. He's a chiropractor, as everybody knows. He's a clinical nutritionist, national international speaker, author of Amazon #1 bestseller, Inside Out Health. And his clinic in Westchester is just south of New York. He was the principal investigator on our level 1 clinical study, FDA study for neck and shoulder pain. And he's got some other studies up his sleeve, which we cannot go into yet. Hopefully this book that Rob was bringing out, Superhighway to Health, which was supposed to be out last year, is hopefully going to be out August 2021, unless we have a third wave, a fourth wave, and a fifth wave. So fingers crossed, Rob, we'll get it out and we'll get you out there. So over to you. I will take the camera off myself and leave it in your capable hands.
Thank you for that sterling introduction. I appreciate that. That book is on the way. I'll send you a chapter this weekend, and I am happy to be here. And I do want to piggyback on what Simon said as far as the basic intro to laser therapy. I just taught an advanced seminar. And even in the class advanced, when I say advanced, you have to own a laser, you have to own it for 5 years, and you come and I show you some what we call advanced techniques. Still, some of the basics are forgotten, and still some of the basics aren't shared with your patients. For your success, for your patient's success and understanding of being compliant, these are the basic concepts that you want to take and speak to every day. And they really are the differentiation between an Erchonia laser and other lasers. And they're a differentiation in what a laser is versus an LED. So I really want to get into that. Also, I do encourage you all. I like to be very extemporaneous. Simon will be on in about 45 minutes. He'll be back. Please answer questions. If you have a demo that you require, I'm going to do some demos at the end. I've got my team here. I've got all the lasers here. You probably see one in the background. I'm happy to share anything with you. Anything goes. The mic will be open, and we're going to start right now. So let's talk a little bit about the idea of laser, in the idea of the introduction to laser therapy. You know, laser was a godsend for me. I don't know if you guys noticed or you've seen me before, but I suffer from congenital torticollis. So growing up in a tough area in New York City and having something that people didn't understand, you know, you have lateral flexion to the ipsilateral side, contralateral rotation to the other side, you got into a few what we called scrapes. But I was always searching for help, and the help came in the form of chiropractic. So at 21, I went to a chiropractor. I was in a business school studying business and playing college basketball. and I was touched by a chiropractor, and my whole dynamic, the whole dimension changed. I went to chiropractic school, and everything changed. My mission was just to help people. Now, interestingly enough, the reason that I was attracted to the laser was a twofold reason. Reason number one is I'm always excited by healing the body expeditiously from the inside out. In addition to that, I needed something for myself. It was getting very hard to get adjustments. My neck was fusing, things of that nature. So I originally bought the laser for me. Got tremendous results on me, then started to share it with my friends and family, most predominantly my mom, shared it in my practice. 12 years later, we're here today. So let's dig in. I always like to start with a quote. Hippocrates once said, "Everyone has a physician inside of him or her. We just have to help it in its work." The natural healing force within each one of us is the greatest force in getting well. That really piggybacks on the idea of fixing the body from the inside out. I was able to get this Globe News Wire. It spoke to the idea of cold laser therapy is expected to generate almost $7 million in the US. I didn't get a UK number yet, by 2030 globally. So really, when you unpack that theme, you are seeing that laser and laser therapy is growing worldwide without question. The idea that should I or should I not have a laser is no longer the question. The question is which one, how to apply it, and which conditions do I treat in my office typically. So laser, what is laser? Well, laser is an acronym. It means light amplification by stimulated emission of radiation. It's a focused beam of light that emits photon energy. And I'd like to anchor to the idea of photon energy. All photons traveling in the same direction at the same wavelength are deemed a coherent light. So you have a great picture at the bottom of my slide of coherent light. That is obviously, or that is a 635 nanometer light. We know so because the red wavelength is 635. The wavelengths are colored in the color spectrum, coherent. It looks like a perfect wave that's repeated throughout its course of time. So what is low-level laser? Well, it's been called photobiomodulation, low-intensity light therapy. Here's a huge clinical gem. It's photochemical, not photothermal. There is no heating with these lasers. Now, you stop and say, well, many patients like heat. Well, in my office, I'm a big proponent of ice. You don't want to heat an acute condition. You don't want to heat a brain. Yes, we do laser the brain. You don't want to heat a nerve. So the idea of photochemical is much more flexible and universal for clinical outcomes. The light will trigger a biochemical change within the cell. It's compared very favorably, and this works great with patients. This is photosynthesis in plants. This is photosynthesis in our bodies. Photons are absorbed by cellular photoreceptors, and without question, they will trigger chemical changes. So those changes, what I tell my patients are increased ATP, oxygenation, and neurotransmission. So when you direct the laser to the effective site, you're now allowing photons to enter the tissue. The photons will alter the cell permeability. Again, another clinical gem. One of the keys to increasing and enhancing laser effectiveness is to have good cell membrane health, because cell membranes should be bidirectional. They should allow nutrient ingestion and toxic egress. Some of the things to increase cell membrane you may want to consider to give to the patients or share with them are omega-3 fatty acids and alpha lipoic acid. Once it enters the cell, there's a cellular photochemical reaction. It's absorbed into the mitochondria, which we've always called the powerhouse of the cell because it makes efficient ATP. Now, the efficient ATP is critical because when you go through the citric acid cycle, you make ATP, but effectively, you don't release that many free radicals. So the real question is, what sites are going to be more positively effective by mitochondrial activity? Well, the number one organ in the body for mitochondrial activity is the brain. Today, in this health pandemic, what we're finding out is that the number one complaint that patients that are post-COVID that they have is fatigue. It is this virus, a vampire to the mitochondria. So obviously this is a great starting point. Addressing all that are the resulting effects. The resulting effects of using low-level laser are as follows. You get rapid cell growth, so therefore you get increased metabolic activity. You get increased angiogenesis, the making of blood vessels. You have increased vascular activity, and you get a suppression of the inflammatory pathway, the COX-2 pathway, therefore leading you down a very precipitous path of decreased inflammation. Many people have asked me, and this is a basic theme, laser therapy, the 5 components that are integral to beneficial outcome. Very simple. The number one thing, and please, let's really lock onto this. The active ingredient is the wavelength. The wavelength is a color. It is a component that's responsible for influencing the biochemical cascade. We use 2 wavelengths typically. Number 1, 635, which is a red wavelength on the visible light scale, and 405, a violet blue, if you will, on the visual light scale. The number 2 most important component that I believe that leads to beneficial outcome is the dosage, the intensity, the power of light. We only deal in milliwatts because too little or no dosage limits the response. Too much will produce an adverse effect, i.e. like heat. So our lasers, very simply, and I will detail them and pick them up, the EVRL, the Erchonia violet red laser, the red light in all handhelds are 7.5 milliwatts. The violet in the handhelds are 5 milliwatts. And when I show you the large Gothic statuesque looking laser called the FX635, the milliwatts in those diodes are 17.5. Again, emphasizing the idea of milliwatts. Delivery mechanism. The manner in which light is delivered determines the proper tissue response and the depth of penetration. It's not power, it's absorption. It's not power, it's the ability for the body to communicate. It has been stipulated by David Sinclair and Harvard University that the first sign of aging is the loss of communication. The laser works on enhanced intracellular interconnectivity in the body. Lastly, coherent focused light ensures deep tissue stimulation and absorption. Now some of the things that we've added, movement, advanced. Again, when I demo, you'll see moving the laser. There's nothing wrong with keeping it in a stand. But if you're in the room with somebody, you want to move it, your handheld at some point, because that's going to turn the muscle on and off and allow you to get over physiological stages that are, if you will, that are stuck, where you want to get more clinical outcome. You don't have to worry so much with the FX635 because it moves and it's built in. Again, we'll demo that. And it's pulse. If you want musculoskeletal health, delivering short pulses of energy are the best way to achieve that. So mitochondria, interestingly enough, mitochondria stimulation activates signaling pathways and upregulation of transcription factors, eventually increasing growth factors. Low-level laser in the mitochondria will enhance neurovascularization, angiogenesis, again, the growth of new blood vessels. You'll have increased collagen synthesis leading to 1, healing of acute wounds, 2, healing of chronic wounds, and ultimately the laser will help you heal skin, nerves, tendons, cartilage, and bones, so it can be used for a plethora of different type of conditions. One takeaway, the idea of the mitochondria, is that the mitochondria has always been, as I said before, called the powerhouse of the cell. It is not just the powerhouse of the cell. Mitochondria comes from bacteria. It communicates with your gut. I believe the gut is the epicenter of your health. The fact that it communicates with your gut really speaks to the idea that the stimulation of mitochondria helps with immune function, most predominantly the innate immune section of your body. This is interesting in that it's an inside-out dialogue between the mitochondria and bacteria. Whatever your bacteria does or wherever your gut health is really going to reflect into your mitochondria. So I will show you a gut protocol today, which I believe is a basic starting point that everybody can do in their office starting on Monday. Many people ask me, all right, so if we're basing this a lot on mitochondrial idea, How much does the low-level laser increase mitochondria membrane potential in ATP synthesis? Well, low-level laser is used to increase performance and exercise efficiency. There is a segment of this talk where I'm really going to talk about exercise performance. The data was suggested in this 2015 study that the peak window for increased performance, believe it or not, was 3 to 6 hours after the administration of low-level laser therapy. So let's talk about some of the positive effects of a 635 nanometer light. Number one, it's pain relieving. Number two, it accelerates tissue regeneration. 3, it allows for the stimulation of cell metabolism. It accelerates wounds healings. It increases lymphatic flow. It also has a great pain relieving effect. And you see the laser has a positive effect on the cell energy ATP, and mitochondria. So what's one of the most common questions that everybody asks me? What's the difference between laser and LED, which is a light emitting diode? It's all in the delivery fundamentals. Laser is monochromatic nature, same color, one wavelength. LEDs, believe it or not, are quasi-monochromatic. Laser has a coherent light, the same frequency and wave in phase. The LED can't achieve the same narrow bandwidth of light. Laser is also collimated. Light rays parallel and travel without divergence or spreading, whereas LEDs can be very disorganized or incoherent. Collimated, but that's not truly true for light emitting diodes. So the takeaway is very simple, and this was through multiple studies. Properties determine the effectiveness of low-level laser in the biological system cannot be achieved by other light sources. Light from a 635 nanometer dramatically is more effective for producing photochemical effects than a 635 nanometer LED. So lasers can only be used for light or low-level laser therapy. There is a firm conclusion from the studies. Laser light is much more effective. Other sorts of light often mean by low-level laser without justification. Companies speak inappropriately. And lastly, monochromatic, much narrower spectral of width than other light sources. So many people ask me, can you give me an epigrammatic comment or explanation for my patients? Yes. Laser allows for increased cellular regeneration and increased cellular communication. The cellular regeneration means increased effectiveness of ATP production and increased cellular communication working via the nervous system and through the cell membrane. It's the key to the interconnectivity of the body communicating. So low-level laser, and you see me just demoing one of the handhelds right there, controls pain, reduces inflammation, increases blood flow, stimulates nerve tissue growth, and improves memory and focus. So another major question that people ask at a basic level is, what are the therapeutic laser biological effects? So let's go through these, and then we'll start getting into some hands-on. 1, rapid cell growth. The light accelerates cellular reproduction and growth. Faster wound healing. Laser stimulates fibroblastic development and proliferation, which will accelerate collagen synthesis in many different damaged tissues. It will also allow for increased metabolic activity, increasing the production of the basic food source for cells, which is ATP. It will, and I'd love to share a little story with you on reduced fibrous tissue formation. The laser reduces the formation of scar tissue or fiber tissue from specific tissue damages. It has an anti-inflammatory action. If there's anything that I'd want to do in my chiropractic practice, it would be manage and modulate inflammation. Laser light reduces swelling, causing by inflammation of joints, ultimately enhancing joint mobility. It also increases vascular activity. It also stimulates nerve function. Rockkind has done a lot of studies, and the 635 nanometer light has shown to increase action potentials. So chiropractors, joints, muscles, nerves, that red light is the panacea for helping action potentials and nerves function appropriately. Stem cells, we're all paying for stem cells. It also generates stem cells that helps in cellular repair. Really want to piggyback on the idea of a healthy immune response. because it's shown to strengthen the immune system laser and helps fight off infections. And just one addition, the emulsification of fat within cells. There is a body contour laser, which Simon, if anybody's interested, we could have a follow-up webinar or conversation. But for today, just wanted to put that in. People say to me, because we upregulate, people get stronger. They ask, how does laser strengthen the muscle? It does so very specifically by delivering specific parameters of light that increase ATP production, promote calcium influx, and support proper nervous system function and neurotransmitter release. So this is a wow for the docs. They say, well, okay, how does it increase? How does it make me stronger? How do I increase the quality of my muscle contraction? Muscle contractions require acetylcholine. Acetylcholine actually causes that an electrical impulse. The impulse releases calcium from the inactive form, which is the sarcoplasm reticulum, into the sarcoplasm. ATP causes a stronger contraction. This is the granular look at how laser works at turning muscles on and turning muscles off. To stop the contraction, calcium goes from the sarcoplasm into the sarcoplasm reticulum. More ATP, the better the relaxation. And we all know ATP is required for contraction and relaxation of the muscle. Low-level laser, in a matter of milliseconds up to seconds, quickly and effectively increases the levels of ATP, oxygenation, and neurotransmission. Frequency. Everybody asks the frequency for the treatment. Frequency to me is the period on the sentence. Essentially, the frequency is the number of light flashes per second, and the changing of the frequencies will help all doctors overcome many of the clinical plateaus that they've seen in their patients previously. If the frequency is less than 30, it's visible to the naked eye. It will look like a straight light. Over 30, the light will look like it's blinking and will appear as a continuous light. A couple of quick studies on what low-level laser does. Low-level laser was shown to decrease pain and modulate interleukin-6. Interleukin-6 is one of the more inflammatory interleukins in the body. It's really been shown to stimulate the cytokine storm. So adding low-level laser will decrease that interleukin. In this study, interleukin 6 and 8 were able to be attenuated greatly by the use of low-level laser. The 405 violet light most positively affected interleukin 6, and the red light most positively affected interleukin 8. So that means you're either putting the EVRL on the lower back, adding the FX635, or maybe doing a combo somewhere down the line. Here's the takeaway. Here's what everybody came for. What is the key theme? How does this thing really work? The photons allow for the electromagnetic transfer of energy. That is where the laser really takes the cake, if you will. And one quick factoid, I always like to share a factoid. It's 8.2 billion photons per second per diode. So many people are worried, well, is it getting in? All you need is one photon. With this tremendously large amount of photons being sent in, you pretty much can't miss, if you will. So let's talk about the red in the violet properties, and let's continue on with this discussion of how they're different and how together synergistically they work well. 635 nanometer laser, its properties, it's a modulator. It increases energy flow and dissipates energy if it's too high. Promotes energy or increasing energy through the stimulation of the mitochondria, has an anti-inflammatory effect, enhances ATP protein synthesis, and allows for pain reduction. For tissue injury or wound healing, it allows for collagen formation, increased fibroblastic proliferation. Ultimately, it's known to decrease pain and muscle spasm while also increasing strength and range of motion. And lastly, huge takeaway, it allows for that cell-to-cell communication. The violet light, one's the right hand, one's the left hand. The violet light is a more sympathetic stimulus to the nervous system. It's also shown to help the body defenses eliminate bacteria, viruses, fungal, pathogens, antigens. And that's the reason it's a greater response and a great choice for immune function. The violet light is also shown to work in even a shorter period of time. And the violet light is my choice for the wavelength for vagus nerve stimulation, VNS. Ultimately, when you compare the electromagnetic transfer of energy, many lasers out there are between 800 and 810 nanometers. If you compare the 635 per second, there's a 27% more release or increase, if you will, of energy than an 800 nanometer. And from 635 to 405, there's a 57% increase in the violet to the red light. When you combine them, it's almost 100% change from using an 800 nanometer light to a 635 and a 405 combined. So the takeaway is the lower the wavelength, the higher the electromagnetic transfer of energy. In June of 2019, Konia received the first FDA clearance for non-invasive technology for overall nociceptive musculoskeletal pain. So the FX635 allows you to work on any part of the body with a clearance of nociceptive musculoskeletal pain. A follow-up study, interestingly enough, in this particular follow-up study, was that you had 6 IRB-approved trials. The assessment was for reduction in pain arising from chronic conditions. The active group had a 30% increase over the control group, and the active group also had a documented significant improvement in range of motion, foot function, and oswestry disability index. So much so that this is the second study to really provide that or show that the FX635 provided relief of nociceptive musculoskeletal pain. Today, we're going to demonstrate the FX635 for chronic lower back pain. So a couple of case studies I'd like to go through right now before we go any further. So I'm going to turn my webcam on. I'm going to grab one of my lasers, and just everybody knows, I'm assuming that you guys can see me. Unfortunately, my camera doesn't let me see myself, so maybe that's a good thing. So a lot of people ask me, what's this? And here's the EVRL, the Erchonia violet red laser. So the violet red laser, turn it on right now. I'll put it. Hey, Steph, I need your color. Yeah. So I'm going to bring Stephanie in here. I was going to bring her in a moment. You can see the red and the violet. I'm just going to show them that, and I'm going to do it to myself. But you know what? Since I'm here, we'll do it to you. So if you want to do what I call a protocol to attenuate the cytokine storm of multiple levels and enhance recovery, give me 30 seconds. So the red light is the 635. The violet light is 405. I like to use both of these together. It's my choice for handheld. If you have the Accelerate, you're doing great. So essentially, if you want to boost the immune system, here is my post-virus immune system booster. Nostril number one. It's all right, I'm not going to go up your nose. Nostril number 1. Nostril number 2. If she would open her mouth just slightly, go right in there and get the tonsils. You can close them now. Left side, they see you across the pond. Right side. So each nostril, mouth, each side of the throat, thymus gland, feel free to ask questions, sternum, 30 seconds each point, apex of the lung, middle portion of the lung, middle portion of the lung, lower portion of the lung, lower portion of the lung. She would just turn around, and that's fine. Apex, apex, middle, middle, lower, lower, each 30 seconds, and then I'll sweep the pleural area. Turn around. Now I'm going to show what I call my vagus nerve stimulation. So I am now going to go here. I'm going to go back. I'm going to be mode select. Hopefully everybody can see. And if you can't see, Kate, feel free to interrupt me. I'm going to go to the acne setting. I'm going to turn the violet light on because I want to stimulate the vagus nerve. The vagus nerve is cranial nerve number 10. It runs from the brainstem, the medulla oblongata, down through the transverse colon, speaking to and connecting with through afferent nerve fibers your bacteria inside your gut. It also works through the whole cardiothoracic region. It's been shown vagus nerve stimulation, and I've shown it through heart rate variability that the violet light is your choice, vagus nerve stimulation will decrease or quell peripheral inflammation. So I'm going to turn it on. Violet light, medulla oblongata, about 30 seconds. I'll do 3 to 5 sweeps of the area. So this is also part of the post-viral infection demo. And I'll do the other side. Hopefully everybody can see me because I'm reaching around. Again, I'm doing a quick for demo. And I'm going to go back in here. I'm going to go back. I'm going to go here, user mode. I'm going to go to red and violet. And hopefully you can all see, I'm going to go in the lower right quadrant to stimulating what we call the migrating motor complex in the ileocecal valve, which are typically implicated when the tone of the vagus nerve is decreased. So I wanted to talk a little bit about working within exercise rehab. So I wanted to emphasize you're a football player, as we call them soccer, where I am, in that I wanted to talk about low-level laser and exercise performance, oxidative stress, and muscle reactivity in humans. So here's some treatment points I pulled out from a 2012 study. I actually have the study right here. I want to read some of the interesting things. So it was low-level laser and exercise performance, oxidative stress, and muscle status. They did 6 parts in the front, in the quadriceps. They did 4 in the hamstring and 2 in the gastrocnemius. It was 30 seconds in each spot. It was limited to 5 minutes, and they had a tremendous change in power on the treadmill. So if you have somebody who wants an increased performance, again, we want to talk a little bit about sports in this particular one. We haven't done a real sports one yet. So this was only done with the red light. Treatment points in knee extensors on figure A. Figure B was treatment points in knee flexor and ankle plantar flexor muscles. I'm doing a presentation for Konia. Simon and Kate can speak to it. We're going to have it Saturday night. And I did a lot of research. It's called the Epigenetics of Sports Performance. And in that, we have found out that laser truly helps with epigenetics. So genes are not your destiny. It's your environment. Your genes are only 10 to 30%. It's your environment that creates or allows genes to be shown or manipulated, if you will. And low-level laser had an influence on the expression of 2 specific genes. The first one, COL1 alpha 1, that particular gene is for collagen. So it works at a genetic level. And VEGF, that VEGF was for blood vessels. So lasers are so potent, they work at an epigenetic level. So here's a study that talked about laser therapy for sports performance. It really gives an advantage in sports performance, whether you do it before or after the exercise. Human muscle tissue was positively effective in that it decreased fatigue, increased creatine, delayed onset muscle soreness, and the like. So if you have somebody who wants to exercise or an athlete, you can do it before and after. And that's really where I started with the usage of laser. I was doing a lot of sports at the time, but I found great results in lasering before and after sports performance. So there's a concept of prehab in low-level laser therapy. Can lasers make you stronger? In this particular sports study, the answer was without question, yes. It made you stronger with no known side effects. Now gets into the gut. And we'll talk about the gut a lot in the idea of, I believe the gut is the epicenter of your health. 80% of your immune cells are in your gut. It's where your macro, micronutrients are absorbed. So much so, there was a study of adding a 635 nanometer light and decreasing what we call LPS. LPS is lipopolysaccharide. It's an endotoxin. It's an expression that the gut at its highest level has been damaged. It's shown the mechanism of the 635 nanometer light actually modulated LPS and decreased all inflammatory markers. So low-level laser also reduced the secretion of multiple interleukins It's really shown to help with mesenchymal stem cells. So let me give you a demo on that, Steph, if you don't mind. So again, Kate, if you have any trouble seeing us, please let us know. So light face up. I'm going to come around here. So let me demo a little the 635. Here's the 635, the FX635, which has a complete FDA clearance for nociceptive musculoskeletal pain. So as you can see, it's quite statuesque. It is a built-in stand. When people look at it, they are quite impressed by what it looks like. It's quite easy to use. I'm just going to come over here. It's got 3 diodes. Now, what's interesting about the diode, I'm going to turn it on right now. What's interesting about the diode is that the diode circles. So if you see, again, if you can't see because I can't see my camera, just let me know. It's a circle diode. So you get a lot of surface area. So I'm going to shut a couple of diodes off right now. And is there any way to, yeah, you can see, I mean, she's quite petite, but it's covering a lot of surface area. So I will turn on all 3 diodes, 17.5 milliwatts, 17.5, 17.5. It is, if you will, the Aston Martin of the lasers. And I'll laser hook up. It's just as simple as that. So when you really think about it, I can leave the room now. I can have my staff work within the laser. I can also use my handheld at the same time. And in the handheld, I can also do a vagus nerve stimulation. I can work on her brain. So this really allots me a lot of what I call flexibility. Now, please feel free again to let me know if you have any questions. I'm going to go about another 10 minutes and then we'll open up for as long as we need for any kind of questions. So that would be the gut. Now, since I have her here, let me show you the FX635 for low-level laser therapy. So flip like a pancake. And we'll work on her lower back. And I can just leave it there. So this has an FDA clearance. It was 8 visits for lower back pain. Even though its highest level FDA clearance is nociceptive musculoskeletal pain, it's as simple as adding it there. So some people ask, do you laser or just first? Whatever you're most comfortable with. In many instances, you can adjust while you laser. So Steph, would you turn on your side and face me? A little closer. So she's getting lasered. I'll lift it up. Straighten the bottom leg. I'm going to move it to here. Give myself a little room. She's still getting it on her lower back. In here. And just a little impulse. Go face that again. I'll charge you later. She doesn't have any good insurance. Her boss isn't a nice guy. Little humor. So while she's there, also I want to go over low-level laser for brain-derived neurotrophic factors, BDNF. BDNF actually comes from the gut, goes to the brain, and allows for brain neurogenesis. So at the basic level, brain neurogenesis allows neurogenesis and allows nerves in the brain to heal, to be able to knit up together. So we do a lot of concussion work with the FX and handhelds. We do a lot of brain work with that. So I'm going to get her to stand up in one sec. There's a couple of things I wanted to share at a very basic level. Could you sit? And no, why don't we sit here? So a lot of people ask about upregulation and muscle testing and everything like that. So one of the bigger things we'll do is this. We'll do a C5 muscle test. Press up. So she's pretty strong. Press up. And she's a little weak. You'll take the accelerate as an example and laser in the shoulder region. So that's about 5 seconds. Press up. You got stronger. So that's an upregulation. You see how much stronger the patient can get. Oh, it's going like this right now. So for instance, here's a bicep. So you do your typical muscle tests, your Hoppenfeld muscle tests. Press up. you could just laser the bicep tendon right in here. So for your basic move, and you would move it. So I'm a big proponent of a 3-step. Here's your basic process. Site of injury, passively move, and then she'll actively move. Site of injury, passive, and then she'll actively move. A couple of other easy things. Anything in the upper region of the upper extremity, I'm a big proponent of working within the brachial plexus. So what I found as a finisher to any kind of upregulation, laterally flex, expose the brachial plexus in between the scalenes, anticus, and medius. Right side, left side. And then, of course, you can always upregulate. You can always use it on the brain. So I know I'm giving you a lot. There's a lot to unpack. I'm moving at a good rate, just showing all the different ideas. So once again, you can, without question, use the Accelerate, the EVRL. They're great. They're handhelds. Thank you. Accelerate, EVRL, they work synergistically. EVRL has both the red and the violet light. Remember the red light 635, wound healing, musculoskeletal, great for action potential. The violet light 405 at its basis, it's antimicrobial, antibacterial, antifungal, antipathogen, really good for immune health. I want to go over one more time the post-viral infection protocol. People have been emailing me. They've reached out for Simon. I want to do it one more time. Red and violet light. Nostril, nostril. Don't worry, I'm not going to do that. Mouth, tonsil, tonsil, thymus, sternum, apex. Everything's 30 seconds. 30 seconds, the other apex. Middle of the lung, lower lung, lower lung. Vagus nerve, which really vagus nerves. Right side, vagus nerve. Left side, red and violet in the area of the migrating motor complex and the ileocecal valve. She doesn't have to turn around. Posteriorly, which is make her posterior now. Apex, middle, lower, apex, middle, lower. She had about 20 moves. It's going to take you about 12 minutes. We've had great results with that. Moving now. So as Simon had said, we have about 13 minutes, and I want to do some demos for you. If you don't have any questions, please keep an eye out. My book is coming. Really going to talk a lot about the gut-to-brain axis in this. Superhighway to Health, the 7 steps to optimizing the gut-brain connection. Please feel free to follow me. We've got a Facebook laser group that we do demos 2 to 3 times a week on, posting articles, interactive. People are asking for protocols. That's at the bottom. And if anybody wants to follow me, I'm at all these different handles. Facebook is probably the one that's most popular, Dr. Robert Silverman. So I've got my webcam on. Do we have any questions?
Thanks for that, Rob. Very, very insightful. I'm sure everybody would appreciate that. We've covered obviously the scientific underpinning of non-thermal lasers, so it's always good to look at a different slant of everything. No questions as yet, everybody. So on the right-hand side at the bottom, you'll see an opportunity to put your questions forward to Dr. Silverman. If you are all eager to get off for your dinner, by all means, email them to us and we can hand them on. I think the biggest thing to consider with this as well, and this is something that I have a lot of discussions about with non-thermal low-level laser. We discussed at the start about there being quite a big umbrella for different delivery mechanisms for this. So I suppose we would like to pull ourselves away from that, because this delivery mechanism is all about electromagnetic energy transfer. It's all about creating a systemic effect, so a communication pathway up and down the body, so we can have this systemic effect. Whereas when you go into thermal lasers, it's more about depth of penetration, what level you can go to. And I think it was explained extremely well by Dr. Silverman and also Dr. Rob Sullivan, who did the talks across here.
Yeah, and I want to jump on with you with that. I think that, having lectured for 10 years with Konia, let's say, and the biggest question is, how does it work? And even when docs are experienced and they love the results, they don't realize how it works. And one of the most important things is the very simple explanation. It's photochemical, it's electromagnetic transfer of energy. It mimics the body. It's like photosynthesis between humans and plants. And everybody understands that. And that's a true critical idea. That's a true critical element in the ability to understand that. And it works by the speed of light. So Stephanie's arm really got stronger. They may think that I told her to do that, but you'll see this wow factor. And one of the things that a lot of the practitioners miss is if they don't tell the patient, here's your baseline. So I'm a big believer, if I can segue into the idea of testing, not guessing, whatever you do in your office, we always have a baseline. Make sure the baseline is obvious because you'll get all the points for what the laser does. So some chiropractors have some apprehension because the laser does so much. That's okay. It's all in there. Don't fuddle and worry so much about the frequency. Get it on. The frequency is already set, and get it on the patient. And maybe the biggest practice management as a chiropractor, as a musculoskeletal person, somebody who does functional medicine, is point at the site of injury to start. And you can do injury and nerve root. So I can say shoulder and brachial plexus. Then if it's shoulder, we'll say abduction, C5. Get them, you passively move them while you laser them, and then them get actively movement. Remember, 3 steps: at the site, passive, active. You do that, you're going to have clinical success. You're going to email Simon and I. We're going to get some thumbs up. Hopefully we got some questions or some requests for hands-on. If not, I have a couple things that I kept in my back pocket for everybody.
Yeah, Rob, one question I wanted to ask you is, obviously it's been coming up 2 years now since we in the UK and European markets have been involved with the lasers for pain and accelerated healing after launching Erchonia's fat loss lasers. One thing I found with them pretty instantaneously was they never rest on their laurels, and they're always trying to push the boundaries. I think the study that we're working on behind the scenes at the minute for neck and shoulder pain using sort of 3 different lights is key to them trying to push forward with all this. When you first started, when you were lasering patients, was it always area of pain and the nerve root? Or is that basically something, as time's gone on, we realized that we treat the area of pain, we get a great result. We then add the nerve root or the associated dermatome that expands the result even further. And obviously now a lot of practitioners are also involving the brain treatment to try to create this sort of longer cascade and communication network. Has it always been like that since you were using them, or has that just developed over the years?
That is without question a stellar question. I'm going to ask you to hold 10 seconds. I want to get one of my older lasers.
They're a little bit more smartphone-esque these days, aren't they, compared to the early variants? But we still have pictures in our presentation of Steve Shanks and Kevin Tusek, who were the founders of Konia, working on developing lasers in their garage in their home. And look where they've come in the last sort of 21, 22 years.
Here's one of the more up-to-date PL touches. So it was big. I couldn't find it, in the interest of time. It was big, it was heavy. You could do a bicep curl with it. So what Simon was really alluding to was there's 2 heads. One of the heads would go on the spinal root. The other one would go on the nerve root. So spinal area, nerve root. And it was working because, or the thought process behind it, which wasn't faulty, was afferent and efferent. But what they found out was you didn't need to necessarily do that because it's so fast. When you ran it up the area, you covered both afferent and efferent. And to be honest with you, the cords, the heads, it became for somebody like me cumbersome. So what they did was, in the advancement, they got it in 2 diodes. I'm just happening to pick up the EVRL here, in the 2 different diodes, and they were able to use the area and it worked both afferent and efferently, and you could also draw it. This was the only laser in a much bigger model originally. Then, through evolution, they got the accelerate. Then, through evolution, they had the EVRL, the FX 635, which, like I said before, is a very Gothic, statuesque looking. So the advancement in technology and aesthetics is profound. But more so than that, I did the study. The EVRL has a FDA clearance for decreased pain and increased range of motion. Now, when they did the study, they were comparing it to other red lasers and other studies that they had done. And I said, you know, guys, where I come from, you never want to do better than you always want to do better than you did before, but you don't want to go against yourself, because what happens if it didn't work? Really, to speak to what Simon said, Erchonia is all about advancement in the science, and now we're adding more and more different laser lights and wavelength. I'm in another study, lead clinical investigator, and the results are stellar. So the company isn't sitting on its laurels, but the evolution is made for you. Look how easy this is. This is a pound. I can throw it up now. I could throw it to Simon across the pond and he can catch it, he can head it, or whatever he needs. So the ability to grip it. So I have a relatively large hand. My wife is much. Steph, can I borrow your hand? Could you grip this for them? So Steph's much smaller. She's petite. She can grip it. It's not heavy. She can move that if I lay down. So again, the technology, that's a really good takeaway, Si.
Yeah, and one other question actually that came up earlier today, Rob, which I think one of our attendees may be very interested in. As you know, Konia have discontinued the PL Touch because they are supposed to be having that much success with the Accelerate and EVRL with base stations, et cetera, because you can build up your portfolio over a period of time and include the base station. Now, looking at the PL Touch, you've got obviously the two detachable arms with two diodes in each arm. We're looking at potentially trying to equal what you would get from that clinically by offering two accelerates. Would you say two accelerates and against the PL Touch would be on par, or would you think having two accelerates would maybe be able to expand the scope of practice or the flexibility in the lasers?
For me, the two accelerates would expand it. And the reason is, one, I can only work within the framework of the area in which the cords will allow me to move. That's number one. So for instance, if I wanted to apply two lasers at one time, maybe I want to apply a laser to my head or a laser in my ear and a laser at my knee. So that's number one. Number two, you're going to get more electromagnetic transfer of energy. And lastly, and here's the key takeaway, I can put one in the stand here, and that's holding in this room, go next door and treat another patient. Or if I have two practitioners or two people, I'm now able to use each one of these. So without question, this is a much better, more flexible, viable choice than this. So you can do further parts of the body, and you can separate them and work on two people at one time. You can theoretically have two clinics. You can theoretically treat some people at home. I keep one or two lasers in my house. As a matter of fact, I keep two handhelds and one FX for myself or any emergency patients that need to come by. So again, another really good takeaway of how the technology, by the way, just so I can show you, I hope you can all see, it goes right in my pocket. It's the size of another cell phone. When I travel with it, when I go and we're able to travel where I am, I'm able, people ask me what it is and I just say it's another cell phone, and you know, I'm able to get on planes.
Yeah, it goes, it's very flexible like that. Rob, I think we probably end up, as we normally do, getting questions by email. One last thing I'd like to say to everybody, especially attendees from UK and Ireland, we've just taken on a new UK business development manager, a young lady called Vanessa Brown. Vanessa will be in touch with a lot of you very soon. She's a very smart lady. She'll bring a lot, I think, to our network, not just in the UK and in Ireland, but also all over Europe, especially in this day and age, which I know you're well into, Rob, of digital marketing and social media, etc. So her role won't necessarily just be about managing the sale of lasers. It will actually be helping our clinics develop their practice and making the most out of the lasers commercially, and giving advice where they can, because I know that is more important than ever, which I'm sure you'll agree, Rob.
Yeah, I get a lot of patient on referrals, and maybe we can do a webinar on social media and get Vanessa to do that. But the ability to utilize and elucidate your message is a critical element. And I want to add one more thing. I know it's late for where you guys are. I just got a medical director in, and she had something, and it's an advanced issue. It's called cording. So when I put her arm out, you would see all the cords. So she had some surgery. She has some issues that we found out via blood, that she was getting fibric with her nerve. So the brachial plexus, you saw the three main cords, in the axillary and the musculoskeletal up here, you couldn't see because there's still tissue. So they call it cording. It's called axillary web syndrome. If I touched her whole hand would shake. Oh, I can feel the median nerve distribution. I've been lasering her for 4 treatments. It drastically dropped the fibric component to the nerves. It's 70% better. Now I can finally get my hands and do a nerve entrapments. I can't tell you, speaking of marketing, how many people now she's referred to me for different kind of musculoskeletal conditions. And of course, I want to put that story on Facebook, and she's willing to take a video for me. So all that combined, the laser gave me added clinical outcome and something I wouldn't be able to do before. Now I'm packaging and marketing, kind of like you said, and that's why I wanted to share that story.
Brilliant. I don't know if too many members on this post, Rob, are associated with the FIX organization, the Sports Chiropractic. It's something, again, that Konia USA and Konia EMEA have got involved with. You're doing your talk, I think it's 6:30 p.m.
6 o'clock.
Yeah, sorry, 6 o'clock UK time, isn't it? 1 p.m. your time.
Correct.
Saturday. Sorry?
It's Saturday. It's called the Epigenetics for sports.
Sorry, yeah. It starts tomorrow, and there's all sorts of talks. Your talk is on Saturday. If anybody would like any details on how to get onto this, because there are a lot of good speakers, including Dr. Silverman, Jody and Kate in the office will be more than happy to provide you with a link so you can go on. It's all virtual. We're just trying to get used to that now, because we've got our own little room where people can leave questions and what have you about the lasers. So it's this sort of thing, and also supporting the local chiropractic fraternity, not just in the UK and Ireland, but trying to grow on the success of Konia have achieved in the US, and a high percentage of their clientele over there, which is over 16,000 in North America, is in the chiropractic market. So that's something we definitely want to do here. We're going to be looking into university programs as well, and even trying to see if we can get the lasers onto the curriculum. So the chiropractors and the pain management specialists of tomorrow, when they leave university, they'll have an opportunity to get, I suppose, a broadened approach as to what is out there if they're looking to start their own business.
Outstanding.
Well, on that note, everybody, thank you very much for coming on. As always, let us know if you have any ideas on any topics you'd like us to cover. We're always open-minded. We've got Dr. Rob Sullivan here. We've got Dr. Rob Silverman in New York. We've got Dr. Kurt Gare in California that does a lot for us, and Dr. Trevor Berry in Arizona as well. So we also have Dr. Jake Cook, who does a lot for us in the UK, which I know you're familiar with, Rob. And I think Jake will be a very big part of our educational program going forward as well.
Outstanding.
Cool. Okay, well, at that juncture, thank you very much, Dr. Silverman. As always, it's been a pleasure to have you on. And I'll let you get off, because I'm sure you've got some sort of social media commitment next.
I do. It's funny.
You do. Okay, take care. All the best, everybody.
Take
Thanks
care.
for coming on. Bye-bye.
Thanks for your time.